So welcome again, everyone. This is Dr. Ron Hunninghake. I'm the Chief Medical Officer here at the Riordan Clinic, and we have a series going on discovering real health. And it's my guest today, Dr. Gael Wheeler. Good morning, Gael.
Good morning.
And what we're going to be talking about is stress. And there's plenty to go around. We're living in the era of COVID-19. Where people are, basically they're staying at home, they're wearing masks, they're afraid of the virus, so they have every reason in the world. Financial issues, so there's every reason in the world to feel stressed. But I think, Dr. Gael, what we're wanting to talk about today is how do we understand how that's affecting us physiologically? What can the Riordan Clinic do to help patients understand things that they can improve on regarding stress?
Well, if we take an example of a patient who comes in to see us, say they're coming in and they claim that they're feeling very, very stressed because of all of these factors, and they want to know what they can do to feel better. There are a number of factors that we'd want to take a look at. One of the things we'd want to take a look at is how well they're being supported nutritionally at the micronutrient level. Say we may be doing some testing for vitamin B12 and folic acid. Vitamin B12 and folic acid are used very intensely during times of stress, and they're also used in the generation of energy at the cellular level. So we have quite a demand upon those nutrients. Another thing that we might want to take a look at is the pyrroles, because if a person is high in the pyrroles, that tells us that they have an extra need for zinc and vitamin B6 to help support them and support their moods. If a person has a nutritional deficiency, it absolutely can affect their moods and their ability to be resilient in a stressful time. So those are some of the physiological things that we might want to check and consider.
A lot of people, when they get stressed, a lot of their good eating habits go out the door, and they start turning more to sugar and fast foods, and that can end up causing a deficiency in, let's say, the good omega-3 fatty acids. Omega-3 fatty acids are an important part of brain chemistry and membrane chemistry. And so not everyone in the middle part of the United States is going to get 1 or 2 fish meals a day. So by doing testing on fatty acids, they may find that an omega-3 fatty acid supplement might be good.
Absolutely, absolutely. That's another thing that we could uncover. Additionally, we have an increased need for vitamin C during times of stress. And we'd want to be sure that they were sufficient with vitamin C too. And like you were saying, a lot of times people don't eat the best during times of stress, and they may be eating a lot of sugar. They may be eating that sugar and then later on feeling hypoglycemic afterwards, which can contribute to the feelings of stress, the increased heart rate. They may feel kind of weak and dizzy, palpitations, and they associate that with the feelings of stress. So there are lots of physiological factors that can be considered to really be sure that they're well supported during times of stress.
If you're getting stressed many times during the day, that means your adrenals are firing off with that what's called the fight or flight response. Mm-hmm. And if that happens over and over again, you can get some adrenal fatigue. And there is a very simple saliva test that can be done where we measure the cortisol in the saliva, and it follows a kind of circadian cycle. It's high in the morning, kind of tapers off around noon, and can get actually pretty low around 5 or 6 o'clock in the evening. And that's when people oftentimes are a bit gritchy and tired and irritable. And so this is when vitamin C and some of these other nutrients can make big difference. There are also nice herbs called adaptogens that can help support the adrenal glands. But rather than just running out and taking a bunch of stuff, by measuring adrenal function, it gives us a target that we can shoot for to help patients become more adaptable to these stressful times.
Right. I really like that test. It's a 4-point cortisol test. So you're testing early in the morning, mid-morning, or around noon, later in the afternoon, and right before bedtime. And we should see that nice curve of being high in the morning and falling down at nighttime, allowing us to rest. Sometimes we see that curve flatten. Sometimes we see it even inverted. And there are different considerations as far as what we need to use with those different patterns of cortisol.
We also do an amino acids profile, and one of the amino acids that people I'm sure have heard about is tryptophan. Tryptophan is a very important precursor to serotonin, and serotonin is that neurotransmitter that helps you kind of calm down, get your feet back on the ground, and start to assess situations so that you can make better decisions. And so if you're low in tryptophan, that might be important to supplement. Also, your tryptophan converts into melatonin. So one of the other ways that we see people being affected by stress is they're not sleeping very well. And so by getting your neurotransmitters working better, by having the right amino acid precursors, you can end up balancing out that neurochemistry to help you improve your sleep and your adaptivity to modern situations.
Right. There are so many wonderful tests that we have that can be helpful during these times. And another thing too, I think that's special about Riordan Clinic is that we can take the time to listen to a patient and help them sort out other aspects of their lifestyle. Whether they're exercising or not, or over exercising even can add to stress. And how they're eating and what they're eating. We can really help sort out all of these little pieces of the puzzle for them, both biochemically and lifestyle-wise, to help them get a better sense of control of these times of feeling rather out of control for a lot of people.
Right, and that special relationship that Dr. Riordan encouraged from the very beginning of his approach was the concept of co-learning. And when people come to see Riordan Clinic doctors, we're not there to fix people. It's not like we have all the magic answers, but we have a wonderful set of testing that helps us find out more about how stress is uniquely affecting that patient. So we're learning about each person's unique biochemistry and their unique situation, and then working as a team to help them get more resilient in their life.
That's right. And there's no one formula that we apply to every person. We really do individualize our approach for each person. And that's part of what makes it so powerful.
Well, Dr. Wheeler, thank you so much for giving us a kind of a glimpse into how to understand stress from a physiological, nutritional, biochemical point of view, which is a way for people to begin to take charge of these uncomfortable feelings and gain some strength and resilience as they face the challenges of this modern world. So thank you very much. Any last words that you want to? I'll give you the last word on what's worked for you in terms of stress.
I'd say, stay strong, know that you're going to get through it.
Positive attitude.
That's right.
That's a winning attitude. We're all for it. So thank you very much, and I'll see you later on another one of our continuing series of discovering real health at the Riordan Clinic. Thank you so much.
I look forward to it. Bye-bye.
Bye.